5 easy steps to reset your gut health, says a doctor. With the festive season approaching, it's easy to indulge in rich foods and festive treats, which can take a toll on your gut health. Dr. Katie E. Golden, MD, a board-certified physician in Charlotte, North Carolina, offers straightforward strategies to reset your digestive system and restore balance naturally. Here's how you can nurture your gut and feel your best. 1. Embrace whole, fiber-rich foods. Your journey to a healthier gut begins with your diet. Dr. Golden emphasizes the importance of a whole food, fiber-rich diet for optimal gut health. Fiber serves as fuel for the beneficial bacteria in your digestive tract, helping them flourish. Focus on incorporating a variety of fiber-rich foods such as vegetables and fruits, leafy greens, cruciferous vegetables, berries, and bananas, preferably underripe. Nuts and seeds, almonds, chia seeds, flax seeds, whole grains, oats, quinoa, brown rice, and whole wheat products, legumes, beans, lentils, and chickpeas. Avoid heavily processed foods, which often lack fiber and are high in unhealthy fats that can disrupt gut health. Probiotic boost, including fermented foods like pickles, sauerkraut, kombucha, and yogurt can further enhance your gut microbiome. These foods are rich in beneficial bacteria that help maintain a healthy balance in your digestive system. 2. Stay active. Physical activity plays a crucial role in gut health. Dr. Golden advocates for regular exercise as it helps diversify gut microbiota, which can lead to better weight management and fewer gastrointestinal issues. Activity can enrich the diversity of gut bacteria, contributing to improved digestive health and reducing inflammation. Conversely, endurance training in athletes has shown a positive impact on gut microbiome diversity and reduced gastrointestinal symptoms. Aim for at least 30 minutes of moderate exercise most days of the week to support your gut health. 3. Manage stress effectively. Stress can significantly impact your gut health. According to Dr. Golden, chronic stress and depression can negatively alter gut bacteria composition, which in turn exacerbates mental health issues. Stress reduction techniques. Practice mindfulness and relaxation techniques. Spend time in nature to reduce stress levels. Ensure you get adequate sleep and consider short naps if needed. By managing stress, you can help maintain a balanced gut microbiome and overall well-being. 5. Limit alcohol intake. Alcohol can have detrimental effects on your digestive system. Dr. Golden notes that while many are aware of alcohol's impact on the liver, its effects on the gut are equally concerning. Gut lining damage. Alcohol can damage the stomach and intestinal lining, affecting nutrient absorption. Leaky gut syndrome. This condition, where the gut lining becomes porous, can increase the risk of developing alcohol-related health issues. For a gut reset, consider reducing or eliminating alcohol consumption to support your digestive health. 5. Review your medications. Medications, particularly antibiotics, can disrupt your gut microbiome by killing both harmful and beneficial bacteria. Dr. Golden advises discussing with your healthcare provider the impact of your medications on gut health. Only take antibiotics when prescribed by your healthcare provider and never use someone else's medication. Consider consuming fermented foods like yogurt to replenish beneficial bacteria after an antibiotic course. By being mindful of your medication use and supporting your gut with a healthy diet, you can help maintain a balanced microbiome. Revitalize your gut health today. Implementing these 5 steps can make a significant difference in your gut health, especially as the holiday season approaches. By focusing on a fiber-rich diet, staying active, managing stress, limiting alcohol, and reviewing your medications, you can reset your digestive system and support overall wellness.